Hi, I'm Leslie Orlovsky, Executive Director of the patient advocacy organization Team Phenomenal Hope. And today we'll be discussing a recent article that was published in the journal Pulmonary Circulation, entitled Patient Perspectives on Pulmonary Hypertension in the United States: Burdens, Expectations, and Goals. These authors, they teamed up to write this article from the unique perspective of the patient's viewpoint as they progress through their PH disease journey. But more importantly, they highlight how patients' perspectives are key to identifying unmet needs in disease management, formulating treatment goals, and hopefully providing insights and advocacy to improve PH care. At this time, I welcome you to watch, listen, and hopefully learn.
Hi, I'm Kathleen Richardson, and I am a pulmonary hypertension patient. I was diagnosed in 2001 at the age of 38, and I am now 60 years old and have been living with PH for, 22, 23 years now.
So my name is Lenise Whitley. I'm 69 years old. I live in Brooklyn, New York. I have pulmonary hypertension secondary to left heart failure and recently have been diagnosed with portal pulmonary hypertension. I am an activist. I am a patient. I am a support group leader, and I advocate strongly for patients who have this disease because I feel it is important.
My name is Katie Werner, and I'm the marketing director for Team Phenomenal Hope. Team Phenomenal Hope is a nonprofit organization who supports people who have pulmonary hypertension and provides programs and services that are patient-centric.
So I'd have to say that my initial symptoms were slight shortness of breath and fatigue. Although I got diagnosed so early, I didn't even realize that I was experiencing fatigue because it kind of came on slowly. All I really noticed was the shortness of breath.
The process was long. I first started having symptoms 2 years out, and I went to doctors, and they were told, "Oh, they can't find anything. You need to lose weight." I said, "Okay, whatever." And so it wasn't until I came to New York for another medical condition I had that I found out I was going up and down subway steps, and I would take 3, 4 steps and have to stop and breathe. 3 or 4 steps, stop and breathe. In New York, that could be highly detrimental to your health because during rush hour, you get run down, killed, stomped. Nobody would even know, you just keep going. And so I asked for a cardiologist, and one was recommended. And she did things that nobody else had done the previous 2 years in New Jersey. My doctors had not done. She gave me an echocardiogram, which I had never had. And based on that, she did a left-right heart catheterization. And that is when they found the pulmonary hypertension on the left side of my heart.
I went to a walk-in clinic and told the doctor that I'd been having symptoms for a while, but they got worse recently with the cold. And he kept asking me, when did the symptoms start? And I kept repeating myself. And finally, I had the feeling that he just wanted me to tell him about the recent stuff. And I didn't really feel like he listened to me or wanted to, explore something that maybe was going to take a long time. Once I started going through the process, it was still very early on in the disease. So it had not affected anything, and it wasn't showing up on any of the tests. And so finally, I had been sent to a cardiologist. He asked me if I had ever been diagnosed with panic attacks. And I said, no. And this is not a panic attack. I've never had one, but I knew that it wasn't a panic attack. And, but after he asked me that, I started to question myself.
I think that part of it was because I was 58 years old at the time. I had lost my husband a couple of years before, suddenly. So the cardiologist I had at the time, oh, well, maybe it's stress, maybe it's this, maybe it's that. He didn't take me seriously. He did have me wear a Holter monitor for 3 months. And he said, oh, you have a little problem with your heart, but we'll monitor it. Nothing to be concerned about, even though I had been admitted 4 times for low heart rate. And even though my heart had actually stopped, he said nothing to worry about. I feel also because I was overweight at the time, definitely overweight, but I've been overweight for 30 years. It never stopped me from doing anything. So I didn't see where that could be the problem. And also, I feel it was because I'm a Black woman. And he just did not take me seriously. So I knew that I needed another cardiologist or I needed somebody else, but I didn't know where to go. But I think basically what happened was that I was older, I was Black, I was overweight, and I had just lost my husband. I think all those factors contributed to them not taking me as seriously as they should, even though the medical situation should have called for it. I mean, your heart stopped. Somebody should have done something.
No, I had never heard of pulmonary hypertension before. I didn't really know anything about it. The doctor who told me about the diagnosis said that it was a serious disease and that I would need to go to a cutting edge learning hospital.
I think my first reaction was relief because finally somebody said, yep, there's a problem. So my first was relief. My second was, well, what's that? Do I need an inhaler? Do I need a pill? I knew I needed something. It wasn't until later that I realized what pulmonary hypertension was and just how serious it was. Honestly, at one point, I think maybe it was 6, 7 months after my diagnosis, I just felt like this is too much. It's just too much.
But as far as a prognosis, the only time I had any idea was when I would look up information, and that was not very good. Because at that time I think it was like 2 to 7 years from diagnosis that people would survive, an average.
I had to retire at 61 and I was not ready. It was devastating to me because I had went to school. I had, I went to college late in life and I'd worked towards a certain level that I wanted to be, and I was not going to be that level. So it was very, I was not ready for retirement, but I had no choice.
I think initially it was hard to know how much to tell our kids. We tried to be upfront with them, but at the same time, not to give them too much to worry about. And I didn't know for a number of years how it had impacted my middle son. He had written a poem for school and talked about how he wished that I wasn't sick and that I didn't have PH. And I was a little bit surprised that that came up for him.
People don't understand it, but people don't want to understand it, especially when it's a family member, because they don't want to admit something is wrong with you that cannot be fixed. And it took me a while to understand that. That's the thing about pH. If you're on tanks, you're regulated by those tanks. Your tank only has such amount of oxygen on those liters. That's when you know you better hook up to another tank or be home. Somebody actually told me that. Your tank makes me nervous. I just can't deal with the tank. So I didn't get a ride because the person couldn't deal with my tank. Meanwhile, I can't be without my tank. So, what was just so crazy. And that's why it's lonely, because people are looking at your outside, not what's going on your inside.
Heard about people not having enough money for food and trying to make a decision between whether to get food or to try to get their medication. But there are organizations that kind of help out with that, but sometimes patients don't know that, and sometimes what they have is limited as well. So
I asked my doctor, how much is this expensive? No, it's not expensive. That's what he told me. The pharmacy calls me, Mrs. Whitley, this is $300 and something copay. Cancel it. I call him back. What is not expensive to you? I don't believe they have any idea how much this medicine costs, because I think that really they believe that a lot of people get Medicaid and Medicare, and not everybody does. I have my pension, my Social Security. I have my own insurance I retired with, and I have Medicare. So that means I have a copay. So when they give me these medicines, I have a copay. I think that they don't know how much the medicine costs.
In analyzing the data, a majority of our unmet needs fund applicants are minorities and women.
So I think that with the culture, being a Black woman, the culture itself is very limited when it comes to these things, because instead of moving forward, lots of times, unfortunately, we stay where we're at. Plus the fact, I think a lot of it is, like I experienced, nobody's going to listen to us. And I understand that. I mean, nobody listened to me, but I had to keep pushing. And sometimes I think they just get tired of pushing. But yeah, we need to move forward with this.
first, I would tell them it's not the end of the world. It's very, very scary. But take it one day at a time. Make sure you go to a PH specialist.
It doesn't have to be the end of your world. It's just going to be a different way of how you do things. You won't be able to do everything you used to do. And then some things you'll be able to still do, but you have to do them in a different way. I can still go into the city, but I just have to take medical transportation.
An important thing I would suggest for a newly diagnosed patient is to try to find a support group, either online or locally, so that you have people to learn from who have been there before.
So many patients are afraid to talk to their doctors, which is sad. Personally, I think you need another doctor if you can't talk to the one you have. But go to the doctor with them, ask questions, understand that there's good days and there's bad days. There's days when a person can do things and days a person can't.
And just to be treated like a person instead of a case, I think. It makes a lot of difference to me, and especially in the beginning when you're not feeling well, to have, echo techs who talk to you and treat you like a person.
To me, there is such a shortage of doctors that that specialize in PH. I had mentioned that I had been through 4 different doctors, and out of the 4, only one was a PH specialist, the last one I have now.
I don't really remember my doctor telling me. I think it was more the Googling. And I think at that time I found 2 different associations. One of them was fairly new and is still around today, which is really awesome. And I was so thankful for that, because even though initially I didn't have anybody that, was local that I could share with, I had people online that I could share with. And, we were able to share some of our deepest thoughts and fears.
Oh, I was amazed. There's all these people with oxygen. I'm like, whoa, my people. It was a sense of camaraderie. It was like, oh, isn't this wonderful? It's not just me.
I know the loneliness that can come with a diagnosis like that, and I don't want people to feel lonely. I want them to know that there are people there.
PH is one of the loneliest diseases that you can have because it's progressive, because you look okay. I look fine. Well, except for, the little thing hanging out my nose, but I look fine, but the inside is a hot mess. So I have made PH a platform because I truly believe that now that I understand it, and now that I realize just how serious it is, and the ups and the downs and the loneliness and the despair and going to 50,000 doctors and not being able to breathe. I understand it all. And I feel like I can offer someone some kind of hope and some kind of help, that this is not the end of your life.
Through our Megan Michelle Hicks Fund for Unmet Needs, Team PH is the only nonprofit organization in the pulmonary hypertension space that offers direct financial assistance for non-medication needs, such as groceries, rent, utilities, or even transportation to see their care team. We created our research award, the Phenomenal Impact Fund for Global PH Research, in 2019. We wanted to contribute to research into better treatment for pulmonary hypertension and eventually a cure. Each year, we award $50,000 to a researcher in the field for novel concepts. Our Let Me Be Your Lungs program is really the heart and soul of this organization, and it's actually how we were founded in 2012. So anyone who wants to fundraise, hold an event, a benefit, or participate in an endurance challenge can join this program and raise funds and awareness for Team PH and our cause. The most fun part about this program is being able to match up each participant with someone who lives with pulmonary hypertension, and this really amplifies education and advocacy. Our virtual support group connects PH patients across the country, a lot of whom may not be able to attend in-person meetings. Our meetings focus on educational topics. So for example, for our next meeting, we will host a chef who will walk us through preparing a healthy and delicious meal. There is a gap when patients go from pediatric care to adult care. We see our teenage community being underserved in that gap. Some of the input we receive is that there are many resources for pulmonary arterial hypertension, or PAH specifically, and not as many for other types of PH. When we think of chronic illness, of course, physical health is top of mind, but I think sometimes mental health is put on the back burner. I think we could all agree there could never be too many mental health resources.
Well, I'll have to say first off that it has improved over the years. The more primary care doctors know about pulmonary hypertension, the better, because they're usually the first line. There's so much testing that has to come first before you even realize you've got pulmonary hypertension.
I would like to see more attention focused on PH. We see attention all the time focused on cancer, and other diseases, but not on PH. It's like this hidden disease that nobody wants to talk about. I would love to see that. I would love to see it focused more in the media and social networks. I would love to see it focused more.
Well, I'd like every patient to have immediate access to what they need. I'd really like to see every PH center have all of the access to testing that they need.
More support for caregivers of PH patients. It's not an easy life. I truly feel like this manuscript, like studies, are so incredibly important. I feel like we can't move forward if we don't have studies, if we don't have manuscripts written. We have to have these things in order to move forward to cures and to just being able to have a great quality of life.
Finally, today we have heard from the authors about the substantial impact that pH has on our patients, ranging from the known physical impacts of the disease to, let's face it, the less discussed emotional and social impacts for both patients and their caregivers. If you want to learn more about the authors' discussions, please use the QR code displayed at the end of the video and you can view their article for free. And finally, I'd like to thank the authors for their insights, for their forward thinking, and hopefully how to improve pH care. And on behalf of our patients and families that we serve at Team Phenomenal Hope, I thank you for your time and I hope you have enjoyed these discussions.